Hello, I'm Dr. Jason from Carolina Value Pet Care, and I would like to help you better understand dog vaccination. So, one of the common questions I'll get is, hey, just what vaccines does my dog actually need? So, there's a couple different things, and it just really depends on the lifestyle of your pet. So, that's why when you come in, we might ask you some questions like, what does your dog like to do? Are you going to the doggy daycare? Are you going to a dog park? Do you like to go hiking? Are you out in the woods a lot? Things like that can give us a better idea of exactly what you need. There are certain though vaccines we recommend to everybody. Number one being rabies virus vaccine. Rabies transmitted by raccoons, bats, skunks, foxes in the U.S. There's no cure for rabies virus if an animal gets it or if a person gets it. And if one of our dogs or cats gets it, they can give it to a person. So for that reason, we make sure everybody is protected against the rabies virus with that rabies vaccine. The other vaccine that we recommend everybody getting, we call it the distemper vaccine. It's actually a mix of a couple different things. There's a distemper virus that causes respiratory issues, especially in young dogs, that can progress into neurologic things and even seizures. There's adenovirus that can cause a inflammation of the liver. Parvovirus you may have heard of before, especially puppies. Horrible vomiting, horrible diarrhea can be fatal if left untreated. Parainfluenza virus, part of the things that you'll hear sometimes called kennel cough. Well, one of the viruses that can kind of lead to kennel cough is this parainfluenza. So that's all in that distemper combination vaccine. Speaking of that kennel cough, the other one we give for kennel cough is called Bordetella. Bordetella is a quick little thing. We just give a little squirt in the mouth, no needle or anything necessary. Keep them protected against that. And less likely, if they did get kennel cough, it'll be a much weaker version of it than if they weren't vaccinated for it. And then, depending on their lifestyle, we may recommend the leptovirus vaccine spread by wildlife in their urine, mice, rats, and other wildlife. So if they're outside and gets on their paws from any urine that could have been in a puddle or just laying around, they'll lick their paws and then they can get it that way. So we'd like to cover them for that. Lyme disease spread by ticks, canine influenza virus if they're being around a lot of other dogs, especially boarding facilities or dog parks, boarding facilities, things like that. We would possibly want that canine influenza vaccine. So it really just depends, and we can help you figure out what's going to be the best for your own pet. Another question is, well, are these vaccines safe? I know it seems like we're vaccinating for a lot of different things, but we are always thinking about safety as well. A lot of times, the biggest side effect we're going to see is maybe some muscle soreness, maybe a little lethargy or tiredness the day of a vaccine, just like when we would get a flu shot or something like that. Maybe about 0.01% is the amount of times we actually see some more serious signs in dogs. So 0.01%, another way of saying that is one out of every 10,000 dogs. So I may see 10,000 cases or clients and pets a year just working in practice. So maybe one case out of the year, I'll actually see a really bad side effect from these things. But even with those bad side effects, typically I can give a dose of epinephrine, just like a person with an EpiPen that you kind of jab in your arm or your leg. We can give a dose of that also while they're at the clinic. So we can kind of prevent those things from getting any worse, maybe a Benadryl shot, something like that. So with that, I always think about it's way better prevent these things. We see them more commonly actually just out in nature than we see these side effects occur. So for that reason, I think it is always safe to keep them vaccinated for those. When do we start vaccines? About 6 to 8 weeks of age as a puppy. That's right about when the immunity that they get from their mom starts wearing off. So we need to start kind of boosting their immune system to work on its own now. So I'm going to start giving them those vaccines around then, booster them every 3 to 4 weeks until they're about 14, 16 weeks of age or so. And then that's going to be good for the year. What should you do? Let's say you do have some concerns or your dog's acting a little bit differently after their vaccines. If we're still open, definitely bring them right back on in. We'll take a look, making sure there's nothing serious happening. If there is, we can do epinephrine, we can do Benadryl, even a steroid shot, something like that, to making sure nothing gets any worse. Most of the time, though, it's just going to be they're kind of tired and just want to lay around maybe a little more that day. If we're not open and you're concerned, I would just kind of find your local veterinarian or urgent care place or an ER place that definitely will be open at all hours. And you can certainly get a veterinarian to take a peek and making sure nothing bad is going on. All right. If you have any other questions, feel free to visit our website, www.carolinavaluepetcare. Our schedule is on there too for all of our next upcoming clinics. Thank you very much.